Hello, Dr. Doni TV lovers, wherever you're joining us from. Today we want to talk about ectopic pregnancy. Okay, ectopic pregnancy. Yes, this it happens to women within the reproductive age. Okay, and it's generally said is a pregnancy that is formed outside the womb, outside the uterus. Okay, the uterus has two tube that carries sperms down to the uterus. So when an ectopic pregnancy wants to occur, maybe due to sexually transmitted disease, or maybe due to a scar within the tube that will result to a blockade of a flow of a sperm down to the uterus, ectopic pregnancy can occur. Why? Because there is an inability of this sperm to move into the uterus. So as a result, the pregnancy start growing from there. Within the first 2-3 weeks, it start growing, and if you cannot move further, it can actually burst, resulting to extensive or excessive bleeding. Okay, and when there is bleeding, patient can go into shock. All right, most of these patients can go into shock when they have bleed inside them, and you notice that the abdomen, in fact, when you subject them to do a scan, they will see a collection of hemoperitoneum contents, okay, within the abdomen. All right, and again, you cannot make this as an ectopic without you actually subjecting them to a pregnancy test. Very, very important. And as soon as the pregnancy test comes out and it confirms that yes, the pregnancy test is positive, coupled with the bleeding PV and the scan, yes, you have finally made an assessment of ectopic pregnancy. And even endometriosis can actually result to people having an ectopic pregnancy too. Okay, now why it happened is that there are people who have sexually transmitted diseases that they did not really treat it properly, and because of that, it leaves some kind of variants of infection into their womb. Then these infections get to the tube, causing a blockage of the tube. Then when there is the sperm coming in after intercourse, when the sperm is meant to be move down to the uterus, it will not move. It's stuck at the tube. Okay, now resulting the fetus or the ongoing pregnancy not to move into the uterus. Now some of them can present with pain, excessive pain, all right, lower abdominal pain. They will present with pain, and they will tell you they have history of bleeding and so on. And you have them, when last did they have intercourse, when did they see? They will give you adequate history about their last menstrual period. Okay, so after all these things are made, you have no choice than to cancel them for emergency sapingectomy, because that's the only thing that can save them now, in order to look for that tube that is infected or that is blocked, and remove it. Okay, you remove it and tie, while the patient go on with one tube. Yes, they can have their normal safe delivery as well. When after sapingectomy, after one of those tubes has been removed, they can have their normal pregnancy again. Okay, so but you have to cancel them, to tell them to avoid, because if they must do, they must be protected except they are married. Okay, because there are tendency of ectopic occurring again, because of the history of previous ectopic. There are tendency of this ectopic also happening. Okay, thank you for joining us. We'll bring more details for you. If you have any question, please, concerning ectopic pregnancy and what to do, please quickly ask, comment, like, and share. Love you. Dr. Doni TV love you. Have a lovely day. Bye.